shoulder. But remembering to distinguish that we have the pelvis made up of the ilia, the pubis, and the ischium. So let me start there, since I already said it. And there's going to be various bony landmarks and other like things. However, what's nice is that if it's part of the ilia, most of the phrasing is going to have ilia something in it. So iliac crest, anterior superior iliac spine. I find that confusing because this is superior to that, so it's always bothered me. But this is called anterior on the front, superior iliac spine, and it's part of the iliac spine. So the whole thing is the iliac spine. And so we can find that, when people find the top of their pelvis. What is confusing is people will call this their hip. This is the hip. So ilia, anterior superior iliac spine, posterior superior iliac spine. So I find that here, where it meets the sacrum, and I find this one here, where then the hip flexors would be. So iliac spines, wow.
So the superior points are ultimately the end.
Yeah, which is why I find silly about it, is that they're not superior, they're just the end. The front end, la frente, or derecho, before, and then the back part. So anyway, that's what they're called. You're stuck with it. And now
so front,
anterior, frente. Frente.
So,
Yeah.
So
Derecho's just
so it
forward.
would be frente, ilia. So it would be, it must follow the same.
Some very similar, like esqueleta isn't too far off, right? Skeleton, musculatura, and everything. But anyway, don't get loose. It's coming and then. Okay. So, all right, ilia, pubis, which that one's not usually hard to remember. What attaches here? The pubis is where rectus abdominis, your six-pack muscle, and all of your adductors, so these inner thigh muscles. So you'll see, I'll bring this model over to point them all out here in a sec. And then the ischium. So that's the part of the pelvis you actually sit on is the ischium. And it's kind of hard sometimes. The pubis is just this section, and then ischium down here. So ischial tuberosity is what the hamstrings attach onto. I take the glutes off without things falling apart. So pelvis. By identifying that, the glutes are here. Gluteus maximus is here. Gluteus medius is here. Gluteus minimus, tensor fascia lata. Then we have sartorius, rectus, femoris. So based on sartorius and rectus femoris attach essentially right onto the anterior superior iliac spine. So running anterior, we have sartorius, rectus femoris, tensor fascia lata, gluteus minimus, gluteus medius, gluteus maximus. All kind of following the ilia, the ilium. Here, related to the pubis, that's why when a person is laying on their side, I can get the adductors and the hamstrings better. Once we're to the actual hip joint, we can start thinking about the muscles that connect the hip joint to the pelvis. And so that's the deep lateral hip rotators. which I feel like they could just be called the lateral hip rotators. There are 6 of them, 6 deep lateral hip rotators, all of which attach onto the greater trochanter and come over somewhere here onto the pelvis, okay? So attachment-wise, it's always going to be related to the greater trochanter and come over. And they'll start quite high and they'll go low, but they all attach here on the posterior side of the body. So that's those ones, under gluteus maximus. And there's 6. A nice way to remember all of this is 3 hamstrings. So 3 hamstrings, 4 quads, 5 adductors, 6 deep lateral hip rotators. You can just remember how many there are that can guide you with, all right, I know there's 3 here. I'm gonna bicep femoris, semimembranosus, semitendinosus. Now we go. But just looking at the structure, all this, and then I had talked about how beyond this, there are muscles that move the pelvis, but they're up on the low back. Your obliques can be a part of this. The most famous, really, it tends to be quadratus lumborum, which is deep, attaches onto the iliac crest and goes up onto the lumbar spine and the first rib. So it's involved with this. It's also involved with breathing. So a little bit of knowledge there. And just look at the shape of it, how it's kind of an elephant ear, and then coming over onto the long bone. Very similar to the scapula and the shoulder joint. It's just that the shoulder joint and the scapula are much more mobile. So the scapula doesn't have an immediate hard joint interface like the pelvis does with the sacrum. The scapula can slide in a variety of directions. You can do upward rotation, downward rotation, elevation, depression, protraction, and retraction. So, with that we got upward rotation, which comes along with abduction, then downward rotation, which will go along with adduction, elevation, depression, protraction, and retraction. So it gets a little bit confusing because you learn abduction, adduction, but then there's specific movements for just the scapula. Just like at the spine, lateral flexion, all of that. And then the shoulder joint can do everything, has tons of mobility. As a small shortcut for both of these, I tend to say, start thinking about how is the scapula moving and not worry initially as much about the shoulder joint. It's closer to the torso, and if this is offset, if the shoulder gets offset, it's going to do something to the scapula, vice versa. But this is safer. You know, this is where your bad arthritis and your nerve impingement can occur. So worrying about the scapula, worrying about the structures that attach onto the pelvis tends to be a better starting point than going specifically at stuff related to the joint. It's just a little, it's not a perfect shortcut, but it's a bit of just a safer philosophy to work off of.